Good afternoon, my name is Zahir Abbas and I'll be your clinician for the afternoon. Can I confirm your full name and date of birth, please, sir?
Yeah, it's John Smith, 19th of December 1940.
John, Mr. Smith, what would you like for me to refer to you?
John will do fine.
Thank you, John. Like I say, my name is Zahir, John. Can I just confirm how old you are now, please, sir?
I'm 84 now.
84. John, I understand you've had a bit of an episode where you've had a fall earlier on this afternoon. Would that be accurate?
That's right, yeah.
And that's the reason the paramedics have brought you here today to the A&E, is
That's
that right?
it, yeah.
Lovely. John, what I'm going to do is ask you a few questions surrounding the whole situation. Once I've asked you those questions, I will share the same information with my senior team. So it will remain in the strictest of confidence, except I'll be sharing that with the medical team so as to inform the management as to the current presentation once we've formulated a bit of an idea as to what's going on. Would that be okay with you?
That's okay, yeah.
Lovely. So without further ado, John, if I might ask you what it is that exactly happened today.
Well, we've been sat watching TV. It's about tea time on Saturday afternoon, and been sat there for quite a while. My wife had gone into the kitchen to make us a cup of tea. I decided just to get out of the chair to adjust the television and found myself on the floor.
Oh my, wow, okay. And when exactly did this happen? I mean, I note we're on 8 o'clock now, and I also noted on the paramedics notes and the admission notes to the ED that was at 4 o'clock you were brought in, so I do apologise for the wait.
Yeah.
What time might have this have happened?
Well, probably a bit before 4 o'clock.
Okay.
Probably an hour before I was
An hour, so
yeah.
something about 3, give or take 3
Yeah.
o'clock. Okay. And it's the first time this has happened, is it?
It has, yeah.
Okay. So, now, where was this? So this was earlier this afternoon, of course. It was.
Yeah, it was in the lounge.
In the lounge, and this is a carpeted lounge, is it?
It is, yeah.
Okay. So you've essentially got up to you've stood up to adjust the television that you speak of, except then you find yourself on the floor. And what do you recall about that event in its entirety, as much as possible, if you can?
Well, I seem to remember falling, and then the next thing I remember, my wife was shouting at me, John, wake up, John, wake up. And everything seemed in the distance. Anyway, gradually I came more aware of what was going on. But in the meantime, the ambulance men arrived. And after that, they just asked me a lot of questions.
Sure. Did they do an ECG on you at all while you were there? Did they do a bit of a tracing of your heart?
No, they didn't.
Okay, not to worry. We'll have a look at things. Okay, so a few questions around this, if I might now ask, please, John. So you've been sat there watching television. How long might have you been sat there for?
Probably a couple of hours.
A couple of hours, and you hadn't left the seat in that meantime, had you?
Not till then, no.
Sure. And what time was your last meal prior to this episode?
Probably between 11 and 12.
11 and 12, so some kind of 3 hours before, 3 or 4 hours prior to the... And had you had a drink in the meantime, in between, or a snack in between that time?
No, just a small cup of tea in between, that was all.
With sugar, without sugar?
That's no sugar.
No sugar. And are you diabetic at all, Paul?
No.
Okay. The next question I suppose I want to ask is, given the warm weather that is, how much water do you drink on a typical daily basis, and how much have you drunk today?
Well, I don't drink a big lot of water. I usually have a glass of water when I get up in the morning, and probably before I go to bed at night.
Wow. And was that true for the same today as well?
Yeah.
Okay, so perhaps we could do with a little bit more hydration, but again, it's a conversation to have later, I guess, further down the line today. Okay, now in terms of the actual episode itself, so what I've gathered so far is you're sat there watching television for the best part of 2 hours in your lounge. You've had a meal some 3 to 4 hours earlier. You've come to stand up to adjust the television, that is. You've felt you found yourself on the floor. The fair lady has come in, and you then found the paramedics around you when you come to. Is that correct?
Right, yeah.
Okay. So what I want to really understand now is, when you went from the sitting to standing position, did you feel any lightheadedness or dizziness at all?
I felt a bit lightheaded, yeah.
Did the room spin at all, or did you feel lightheaded?
No, I just felt lightheaded.
And was that followed at all by any changes to your vision in any way, shape or form?
A little bit blurred, my eyes went.
Blurring? Did you find there was a blackout of some sort at that moment?
Yeah, it went dark, and I don't seem to remember for a few minutes at least what was going on.
So following the blackout is when you then find yourself collapsing to the floor, did you?
Right, yeah.
Okay. Are you in any pain or discomfort anywhere as you speak?
No.
Before? Okay. Did you hit your head against anything when you came down?
No, there was nothing there that I could bang into.
No. Any pain in the head or the neck?
No.
Any pain down your spine at all?
No.
Good. Any stiffness to the neck?
No.
Okay. Any nausea or vomiting?
No.
Any change to your vision as we now speak?
Apart from when the event happened, no, my
Just
vision's okay.
So that's a very short period of time. I can see you wear corrective lenses, corrective glasses. That's normal baseline for you,
Yeah.
is it? Lovely. Good. When you again just before this collapse, I appreciate you've said you had some visual change followed by then a blackout as we describe it, and as per my conclusion, and the collapse that was. Did you feel at any point prior to this fall any symptoms in your chest, such as chest pain, tightness or heaviness?
No.
Any occasion where you felt your heart beating or anything fluttering in the chest?
No.
Any tightness on the chest?
No.
Did you feel any shortness of breath or difficulty breathing?
No.
And did you at all feel any pain in your tummy?
No.
Have you had any symptoms where you were feeling under the weather, or any temperatures or fevers or lack of appetite, loss of your appetite?
No, not recently, no.
So you don't feel like you might have an infection of some sort brewing anywhere? No. Are you on any blood thinners at all, John?
I do take blood thinner.
Okay, okay. Do you know what they're for? What's the reason?
Yeah, they're to thin my blood.
To thin your blood. And any reason, is it an irregular heartbeat that you have perhaps? Is that the reason you're on blood thinners?
Probably, yeah.
Yes, okay, we'll have a look at that and we'll make sure there's a situation that is. Okay, so I'm quite satisfied with that for where we are. What I've gathered is there were no other symptoms around this episode of falling. You've had no previous episodes. Was any activity that the fair lady noticed where you were jerking motions of your limbs? Or
No.
Good, good. And then how long were you on the floor for, John? Do you know?
I will think about maybe an hour or so.
An hour or so. Okay.
Because at first my wife wouldn't let me get up, and
Sure.
then the paramedics wouldn't let me get up until they checked me out.
Fine, lovely. Okay, good. That's great. I'm quite satisfied with everything you've got today. Do you have any ideas as to what might have happened today, John?
Oh, no.
Okay. Do you have any concerns as to what
Well, I'm concerned that it might happen again unless something's found
Sure,
out.
quite right. So, and any what are your expectations from the conversation today? That and this.
Well, I'm hoping you can help me find out what's gone wrong.
Sure, I should like to think so. Just before I move off and draw a bit of a conclusion to this, home circumstances, John. Who do you live with at home?
You may do, yeah.
You live with whom at home? Sorry.
I live with my wife.
Your wife. And is this in a bungalow, house, flat?
It's a house.
It's a house with stairs.
Yeah.
And you mobilise. I've seen you mobilising in the department, going to the restroom. You mobilise on your own independently.
Yeah, okay. Yeah, I can
Lovely.
knock about. Okay.
Lovely. And you don't have any carers coming in a package of care or anything like
No.
that. Lovely, lovely. Do you smoke at all, sir?
No.
And have you ever smoked?
I used to smoke,
Okay,
but
okay.
not for 60 years.
60-year history. Wow. Okay. And how long did you smoke for?
About 10 years.
10 years. And how many a day might that have been?
I just can't remember. Not a lot.
No. Okay. And that was tobacco only?
Yeah.
Yes. And how about any alcohol? Do you consume much alcohol?
I have a drink every now and then, but not too.
Just a very social.
Not a lot.
No kind of nothing serious. So
No.
wonderful. Okay, so that's everything for today. And I will now go and discuss with the team and see exactly what's happened.
Right.
What I would like to do is I'm going to share with you what I think's gone on. It sounds like you've had an episode of what we call orthostatic hypotension or otherwise, whereby your blood pressure has dropped. So we have got good risk factors here, whereby you've been sat down for a lengthy period of time, 2 hours. You've not really hydrated much during that period, but that is again your baseline. and what you've done is as you've come to stand, the blood pressure hasn't quite kept up with everything, and so what happens is it just doesn't get to the brain in quick enough time. As such, the brain then the body says actually shut down, and that's a blackout that you experience. The body then collapses, you lay flat, everything catches up in the horizontal plane, and you regain consciousness.
Right.
So it's what we call a vasovagal episode. This could be a number of reasons for this. We need to explore and understand what that is. As such, I'm going to ask the nursing team to do a few tests and investigations with you. If you've not already had an ECG, which I think you said you haven't with the paramedics, we'll conduct one over here. Make sure there's nothing going on with the heart and it's not originating from that.
Okay.
I'm going to discuss with my seniors to see whether or not a CT head is warranted, so a scan of your head, just to make sure that there's no bleed there that's going unmissed, given the fact that you are on blood thinners. I appreciate there's no trauma to the head, but you certainly fit the guidelines in terms of your age being over 65. I will ask the nursing team to run your BMs, make sure your blood sugars weren't culprit here, and we'll also get your blood pressure checked. They'll do this in a number of different positions, from lying to sitting to standing, and they'll conduct a number of these readings as well, at 1, 3 and 5 minutes. So lying, standing blood pressure essentially is what I'd like to conduct. We may run some bloods just to make sure there's no infection in the background. That may explain the whole reason as well. So just some routine bloods to see what's going on and anything that might explain it. In the event that all of these are unremarkable, then absolutely great. We can hopefully get you home today, and I'll probably refer you to the Intensive Home Support Service team if there is no obvious finding for today, and make sure everything is going in the right direction. Does that sound for a plan?
Yeah, that's fine. Okay.
Okay.
Will it take longer?
Good question. I should like to think not too long. I mean, the department is quite busy, but I should, like I say, I'll get the whole process instigated upon conversation without delay, and then we'll try and get you home as soon as we possibly can, if it's safe to do so, of course.
Okay.
Is that okay?
No, yeah.
Amazing. Thank you very much, and we'll see you in a short while.
Okay.